Hi, everyone. Welcome back to the podcast. Welcome, all new listeners, and welcome back to those who've heard my content in the past. If you want to know what is the importance of being overly confident and underprepared, the thing that is missing inside your clinical approach, you have to tune into this episode. Before I go on to the podcast, what is new? What's better in life? Always positive focus. What's the new best thing? Life is fantastic. I came back from a vacation last weekend with my kids and my family. I have upcoming course this weekend, which I'm fantastic. I'm excited about. This one is a personal development leadership course to help me, help you guys, help myself, help my family. I'm really big on personal development at the moment, so that is my big kick. Kids are doing great. All the same sports. Wife and I, we are about another 2 weeks away from date night, so I'm excited about that. But other than that, life is great. My calf is bugging me again. I should probably go see somebody about it. Anyways, yeah, let's get on to this podcast. So being overly confident and underprepared, you have to ask, why would you ever want that scenario? And here's why I'm doing this podcast. You ever try and deliver a message? You ever try to help somebody change or help somebody do an action that they're maybe asking you for? So, say for instance, you're talking to a patient, uh, you prepared the whole thing, you deliver on it, and you didn't get the outcome that you wanted. And the question becomes, you like over prepared and you under delivered. So why did you get that equation? And the next step is, what is it that you want to be able to do with your patients and athletes? What's the success that you're looking for? And the one thing I see inside sports PTs right now is that they're over prepared and under delivering. And this comes from conversations that I've been having all week with people who are working their tail off. And now it's becoming a challenge because the outcomes they're not being achieved in the timeline or fashion that you want. So if you listen to my last week's podcast, you'll see it's a very similar theme. And this one is a little different in that, yes, we're talking about achieving outcomes, whether that's patient outcomes or your personal outcomes or your professional career development, whatever it is. But this is a missing clinical piece that if you are looking for exponential growth, right? This is always the people say, oh, it's time-based. You have to practice, 10 years, 20 years, become a master clinician. Listen, everyone here wants mentorship, right? That this is what you want, and you can call it mentorship, you can coach it, you can call it coaching, you can call it leading, you can call it guidance. I don't care what label you put on or what label you want to hear. It doesn't really matter. You just need somebody there saying, "Don't do this. You're doing this right. You're doing this wrong. Do a little bit more. Push harder here. Whatever it is." You don't need somebody saying, "You're doing a great job. You're doing." That's called your spouse. That's called your best friend. That's not their role. And the challenge I see with a lot of physical therapists is that they make these small incremental growths or progress inside their career. And if you're asking me, Chris, how do I don't, I'm tired. I'm tired of listening to the podcast. I'm tired of being the clinic director. I'm tired of doing all these. I'm tired of seeing the same patients. I'm just tired and I'm frustrated. What do I need to do? Because what I'm doing right now is working, just not at the rate I want it to be at. 3 years ago, I saw myself doing something different. 5 years ago, I saw myself doing something different. And if that's the case, you have to ask, are you turning the dials fast enough? Are you doing the things that you need to be doing on a consistent basis that you're seeing the progress that you want? And if you're not, I'm not here to pat you on the butt and say, or pat you on the shoulder and say, you're doing a great job, because you're not. And if you're not feeling that way, if me saying that to you, saying you're not doing a great job, I think you're average, that should fire you up. For those of you who are like, it doesn't, I'm okay with that. That's okay. You can listen to this podcast, but I'm here to light a fire underneath your butt, because the people who are successful, the ones who are massively successful, aren't making incremental changes. Yes, This wave of progress is kind of like mountaintops. The master clinician is not how many years they've been practicing, is how many mountains have they climbed to get to the point where they've been. And now if you just make small changes, you're more of like you're climbing mounds, not mountains. And people who've made these large jumps, who are looking down these mountains and trying to help you climb it a little faster, a little bit steeper, are the ones who saying, I've been there, I would take a harder risk here, I would be more conservative here, and just change these small things. And I want to present to you why being overly confident and underprepared is the thing that is going to set you apart from being an average clinician in a year to being a phenomenal clinician next year, in 3 years, in 5 years. And you're going to have to listen to this episode a couple times to just reignite that passion. And I'm telling you right now, because it's the people I'm talking to, it's the people I feed off of your guys' energy, and I can see you can be in a certain place. You're just not willing to take that leap. You are scared. You're concerned that people are going to judge you. It's going to take too long. It's too risky. I'm not sure if I should do that. People are going to judge me. That's not my personality. Whatever it is, I'm telling you right now, the single piece of advice I can give you right now, based on everyone's I'm coaching and leading at this time, in the last week, in the last month, in the last quarter, it's the theme I see. And that might have to do with changes in the economy. This was supposed to be a recession. People are a little bit more heightened or aware. Their job security is a little questionable. So now they're just saying, oh, maybe if I just stay steady, maybe if I just stay a little conservative. Listen, if you work for a large company, medium size, small size, the thing that will separate you is being overly confident and underprepared. And I'm an employer, so I get this, and I am advocating the thing that will separate you is this concept. Let me explain. Let me take a guess. You are a smart, successful clinician who has worked hard their entire life by studying hard, getting to know the material, showing up on time, showing consistently to the class, so that way you can be successful and be prepared for the exam, do well on the exam, do well on the practical, so that way you knew that you were going to be successful, so you can take the exam and do well enough that you pass and you become a clinician. You got the job that you wanted by preparing and looking at the website, looking at a couple of the things, the bios, and a little bit more about the culture. You got the certification because you studied, maybe you did a residency, maybe you took the CSCS recently, you took the course, you bought the book. Let me guess, you're a very well-prepared human being. All right, ready? And you got to where you are. The challenge you will have next is you're going to stay in the same boat, doing the same things day after day, doing the same process that you've always done until this point in your life, because you're always relied on being very prepared, overly prepared. Here's the challenge that you experience in your career path right now. The patients maybe don't understand yet. They're not listening to you. They don't come back at the rate that you want them to. They don't comply with the things that you want. So now you're over prepared. You create this beautiful program, all these rehab exercises, and it just doesn't connect. So they don't see that. So they don't do it. They're non-compliant. They don't come back. That you don't have the schedule filled. You don't have athletes. You have the same monotonous, sedentary people on your schedule. Why? Because they don't require a lot. They're kind of sedentary. They do enough to show up every time, but they're steady. And so if you want steady, sedentary people on your schedule, I think the overly prepared and under delivery strategy is working. I think you're doing fantastic. Keep that up. And in about a year or two, you'll probably think, well, I'll just keep doing the same thing and I'm going to get better athletes. I'm going to get more filled with schedules. I'm going to be happier at my job. But you're going to still stay steady with sedentary people doing the same thing you've done, overly prepared and under delivering. Now, the question is, how do you get to the point where you get more athletes on your schedule, you get more opportunities? This is where the risk comes along. Let me share a story. One of my first con eds courses that I ever taught, John, if you're ever listening to this, one of my mentors, John DeWitt is his name, and I was working at Ohio State doing my residency. I think it was probably my first year of residency. I was, I don't know, 8 to 10 months out of clinical practice, and he comes up to me and goes, "Hey, Chris." If you know John, that's the way he talks. He's real spunky, fast talking. Hey, Chris. Hey, you want to teach a Con Ed course? I was like, yeah, sure. This is what I love. I love teaching people. Let's do it. I'm like picturing everything ideal and what that looks like. I said, of course I want to do it. He's like, great. You're teaching this weekend. And I was like, excuse me? He's like, no, you're teaching a course this weekend. I was like, wait a minute. Wait, what? He's like, yeah, I need some help on this, and I need you to fill in some stuff, and you're teaching this Saturday. I was like, you got to be kidding me. And he goes, Chris, he's like, this moment right here will define who you are as a clinician. You got to take this opportunity. And what I knew what he was doing was he was offloading and giving me a chance, but he was also trying to fix, behind the scenes how he probably overcommitted to something, or he got in trouble or whatever it is. And so I got that, but I understood that. So I had this decision to make, right? I'm a type A, over prepared type of a PT, just like yourself. So I had to make a decision. I said, you know what? Let's go. Let's party. I'm in. And at that time, I was in residency, so I was still working 70 to 80 hours. I remember I had to teach anatomy that week. I had a TA, a lab. I had to cover a rugby game, all while I'm treating 30, 40 patients still. And then I had to teach on the weekend. So it's probably Monday or Tuesday. I'm like, what am I going to do? So here I go home, do all this stuff. I'm exhausted. I can't do all this other things. So I give the course, I do it, right? Here's what I realized. I gave the course and I felt so bad, right? Like I was like, man, that was an average attempt at content. I was like, that was not me. I was like, John, I promise I can do better. He's like, you did fantastic. And I said, really? He goes, yeah, I think the biggest thing I learned from that was when I did enough, I would have rated myself a C, 70%. I did enough to get the job done. And when I did that, my personality came out. I wasn't so robotic. I didn't have every line laid out. I didn't have every slide perfected. I did one or two slides with one or two words, and I just spoke. Yeah, you had references, you had all these other things, but I could story tell. I could talk. I can speak. I can talk about stories. I can give an opportunity so people understand what I'm trying to convey. I think the course was on hips and or sports PT and the hip and all those other things. And I really developed a passion for hips because I was like, I'm really good at it. And when I gave that talk, I was like, my passion came through because I was good. I was treating those things. And when I was over prepared, I realized that my delivery was off. I was too prepared. I was working on the same things. I was working on memory. I was trying to like recite the same things. I was like, I can picture the word, and it messed up my flow. And when I had less up there, it allowed me to be me and actually be the clinician who actually cares and is passionate about look people in the eye, work the room. And when I did that, John told me, he's like, you came out. Like that was a great chance. And I was like, that was the scariest thing on the planet because it was against or everything I ever worked towards was being prepared and doing these things and practicing for the exam. He goes, you're different now because you're in a service. You're working with people to create outcomes. And when you work and study for an exam, there's an exact answer. And when you don't work with that and you don't have that and people change, you can't come in thinking this is option A, B, and C and D because people don't work that way. Their lives change. They come in moody. They come in super happy on a high and a low. You don't know what's happening behind the scenes. So what you have to do is you can't be over prepared. You just have to come in confident and underprepared and ready for anything that comes your way. And that stuck with me because then I went to the field And I felt like I approached with that clinical PT mindset again. All right, okay, so if the spine board goes down, this is what's happening. Okay, and then when I bandage somebody, I have to use a 2-inch strip. Okay, got it. I had this, and I was so robotic, and I was so like I just couldn't relax. And maybe you find yourself inside that story, you're PT, and you just like you feel like you have to over prepare, and you question every single decision you make. And then I managed spine boards, I managed trauma, and I managed this thing. I was like, holy moly, there's a level of preparation. But at some point, you have to realize like nothing goes the right way, and you can never predict. Working in an athletic training room with athletic trainers who are like phenomenal, what I realized for them, they were in the same hour, they would treat a concussion and with just like confidence. They would treat a wart, they would treat sickness, a headache, then they'd rush off for a spine board. Then they would tape an ankle and they would sit down and relax on the same tone with their heart rate staying consistent. I was like, how do you do that? They adapted to the environment that they work in, that they couldn't over prepare. They just had to be ready. The way to prepare was to prepare less and just be prepared for nothing, just under prepare and just say, anything could walk through that door right now. And I just had a mentorship call with my academy this last week, and this was the same discussion. I didn't know what to do with this case. I think it was a contusion. George brought this up. It was a contusion, and you never know what's going to come through that door. And he asked, what is it that you do? Like, how do I answer this? How do I know how to service things? What do you do with people that you don't know what to do with? And I said, you really just have to know one thing. You have to know what soft tissue healing is. Because once you understand what soft tissue healing is, you can build maps and roadmaps off of that and give people ideas of what the healing rate is going to be. Because you don't have to know a specific sport. You don't have to know a specific movement. You don't have to know a specific tear. All you have to know is, what category does this fall under? What's my timeline? And explain that. At the best possibility, this can be ready by 6 weeks. Worst case scenario, it's going to take you 12 weeks. Somewhere in that, you're going to find yourself. That's all people want. But if you come in with what at week 5.5, it should be here, and at week 6.2, it's going to be here. That person doesn't understand that, doesn't jive with how they work and their brain processes. They just need gauges of time, like generally within these categories. That's what's going to help. And it helps people put it in context to their lives. Now, the only way to do that is what I call freestyle. You just have to be like, all right, what's coming at me? Don't prepare, but you got to have display this confidence. And that's the hardest part that clinicians have. They're like, they start fidgety, they start getting nervous, they start talking out loud, they start talking too much. You ever seen somebody who doesn't know what they're talking about? They keep layering on things. They keep talking about the same categories in a different context. And when you are working with your patients and you don't feel comfortable, confident, the reason why you keep talking is because you're validating it to yourselves. And they read it as, I see. You're just trying to reassure me through volume, through more words to make me feel comfortable. When in reality, all I needed was, it's going to take 4 to 6 weeks. And here's the plan. That's all they need to know. You're in good hands. That's it. Now, if you display that overly confident, heart rate's looking good, you're telling a story, you feel great, weren't prepared for that, but you knew healing timelines and you set those expectations, you know what your job is on session 2, 3, 4, and 5? To go back and prepare. But when you approach a new thing, like you don't know what's going to hit. Tomorrow you can walk outside, your car's broken into. All you can say is, yeah, it makes sense. Whatever happens, happens. It's the person who's like, oh my gosh, my day's ruined. What's going to happen? Blah, blah, blah. I woke up late. Here's what happens. For the person who needs to be overly prepared, they need to wake up at 5:32 a.m. That doesn't happen. Their meal prep isn't prepared in the morning. They have to rush through that. The high anxiety. They don't feel prepared. And they go outside. Their car's broken into, and their day's just ruined. And the person who's like underprepared, they're like, okay, I woke up a little late. Meal prep isn't ideal. I didn't get everything I put in there. My car's broken into. It's all right. I'll take an Uber. I'll get to work. Heart rate's still low. My patients don't feel all my high level of emotion right now because all that does is add to the chaos in your life. And you've met those people who bring the woke up late to forgot the phone to the flat tire, and they bring that to work. And what happens? It just brings up everybody's emotion. And now the patients feel it. Now they don't get it. Now, but the way to overcome these things in your life and in the outcomes you produce is being overly confident and underprepared. You do that and you approach your clinical practice that way. Be prepared for anything that comes your way, a contusion, a new surgical type you've never seen. Yeah, makes sense. But I know healing. I know healing. You know healing. You know healing. You know biomechanics. You set the expectation. It's because you feel like you have to be overly prepared. It's slowing you down. It's the difference between making incremental growth. So the person who's like, for a year from now, I'm going to be doing this. Yeah. And they kind of grew. How many of your peers are just doing the same thing a little couple more times? They're taking the same Con Ed courses. They're only taking one Con Ed a year because that's the only stipend that they get per year. I only get 500. So that's all I'm going to do. They're the bare minimum PTs. They're really not changing. They're not taking the risks or not doing the things that would set them apart from everybody else. The people who continue to do the same things are the ones who do incremental jumps. I'll take maybe one more course. Maybe I'll do one more podcast. Maybe I'll just do one more protocol. Yeah, you know what? I haven't been able to get to that. I'll just get to that one day. And the minute that you can take that exponential opportunity to take one big step in saying, I'm going to take that risk. You know what? I'm going to do 5 podcasts. I'm going to take 3 courses. I'm going to spend my own money. I'm going to put my own time into this. Why? Because I'm willing to make that jump. The thing holding you back is saying, you know what? No, just go conservative. The way you approach getting to the point where you're at right now. The only way you're going to make that big jump is setting the same bar higher. The opportunity that I had to teach that Con Ed course within a 5 days notice pushed me to a new limit. I learned a new threshold. And every single time that I've ever created a new course, a new opportunity for people, opened a new clinic, anything I've ever done is massive, taking this huge leap and saying, let's do it. Let's party, being overly confident. Let's try it. I've never done this. And communicating with my patients and telling them, communicate with my team, to communicate with the PTs that I know and saying, I've never hit this threshold before, but I'm going to tell you right now, I want you with me. And if you can understand that, I have no idea what this territory looks like, but I'm going to do this. And if you can do that, that's when you gain this like confidence that you can take risks and do the thing that you've always wanted to. Most of you haven't leaped into the CSCS. Most of you haven't leaped into the SCS. Most of you haven't taken the courses that you wanted because you're like, I'm just going to ride the wave. This is what I've allowed. And that's what your professional career looks like. If somebody said that to you right in your face, it hits you in the face. You're like, I am kind of doing the same thing I was doing 2 years ago, or what the standard is. F the standard. The standard is what your standard is. Now, if you follow the standards of everybody else, you're going to have small changes in career path. And the reason why you're going to stay the same is because you're doing the standard, which is the bare minimum. You know this. Every PT you know does one Con Ed course because that's what they're allowed to. They have 2 Con Ed courses because that's what they're allowed to. 3 Con Ed courses because that they're allowed to. How about you don't ask for permission and you do the damn thing and you set your own tone and you become overly confident and underprepared? The minute that you take this route is the jump that you will make in your career path, whether that's with students, whether that's with your own professional career, whether that's with the patients that you see. You have to have exponential growth to make those jumps in your career. It's just the thing that you're missing in your clinical approach. It is. You got to make big leaps with taking risks and larger opportunities. Most of you don't do it because you're scared. You're scared, and that's what's limiting you from taking the course that you've already wanted to, the registering for the exam, applying for the job that you want. That's a big one for a lot of you. Let me just work here because it's just a safe job. It's a safe role. You're not taking that risk. How about you just think about, like, what does that mean for you? Are you going to be happy? Are you going to be in the place that's going to push you more? I asked a team member recently, there's 2 categories. Do you have 3 people, your closest 3 people, do they inspire you? on a daily, weekly, monthly basis? If not, you're the average of that. And if you don't have inspiration around you, you're going to be living the same life. Do you have 3 people around you who are where you want to be? And if you don't, how do you feel you're going to grow with no inspiration and no aspiration? If you don't have those 6 people in your life, you stay stagnant, incremental growth, thinking that you're doing great. So find yourself more inspirational people and people who you have now aspirations to be where they're at. You have those 2 categories, you're successful. It'll push you because you see them taking larger risks. You see them doing it faster than you. The problem is you're not around them enough. And this is the growth that I see with people in my academy, people that I mentor. It's not that, I teach them the best exercise or the best course to take. It's, are you willing to push that threshold just a little bit more? You won't be able to do this in your entire career, but there's portions of your career that you need to make that jump. And if you're listening to this, you're like, gosh, that's what I need. Doing the same thing and taking the 1 or 2 courses and looking for the best exercise, those are not going to do it. It's taking the risk to do the thing that you've always wanted to, but not doing it. No, you have the audacity to do that. I tell my team all the time, be audacious. Why? Because I fully support you challenging the norm, taking a step further in your professional growth. You know why? Because I'm fulfilled by that. I'm fulfilled by inspiring people because I want anybody who comes up with me, they're on my leadership team, my management team, they are with me and mentoring. I will tell you right now, your job is to continue to inspire your patients, be inspired by others, aspire to be bigger and greater and bigger. And if you're not, the problem is you're probably surrounding yourself with people who aren't inspirational and not aspirational. And then who are you looking up to? Your peers who are in your clinic doing the same things, your boss who's probably doing the same 4 exercise that they did 20 years ago, your peers who look great on Instagram doing exercises with a lot of views, but really aren't fulfilled. They're not pushing themselves. That's the thing that gives them the drive. It tells them that they're doing great. That's the dopamine that they look for. If you're a clinician who wants something bigger and better, put yourself in position where you're overly confident, underprepared, and you set that tone by being with people who are inspirational and aspirational. You do those 2 categories, you're in a good place. My point to all this is that you just have to take leaps, be overly confident. Don't feel that you have to be prepared all the time because it's the thing separating you for opportunity. That's the thing. How about you just register for the course? I know you've never studied for it. Just register for it. It'll push you to do the damn thing. There's a difference. Take the job that you've always wanted to. Do the thing. Start the thing. A company. You start the position. Ask your boss. I want to be clinic lead. I want to be a director. I want to do these things. The minute you do that, you put yourself in position. You're like, oh shit, now I have to fulfill on it. It's okay. Now you push yourself. And that's the only way that you appear overly confident, unprepared. That's just how you're going to hit it. I've never treated a contusion. What should I do? I've never treated this type of surgery. I don't know. Put yourself in front of it and be overly confident and underprepared. There you have it. That's my rant. I truly believe it's a step for a lot of you. And for those of you looking to be inspired and have the aspirations to be around more successful people, the academy is the next step for you. My mentorship group has people who are willing to take that bound, like that leap and that bound and challenge themselves and put themselves in a different category. Why? Because they're just willing to say, listen, I'm not good at everything and I don't have to be prepared. And they're willing to be in that training room mindset. Like, let's just go. What's coming at me now? I'll take it as it comes. And if you feel like, oh my gosh, that makes me nervous, it's because you're stuck there and you will always be stuck until you take that next step. So the academy is the next step for you. If that's where you're stuck. And I'm excited to have you inside there. It's if you want to learn more, it's drchrisgarcia.com/academy. I'd love to have you in there. And if you are considering it and you need a one-on-one call, you want to talk to my team, is this the right thing? You're not sure. When should I do it? Is that a month from now? Is it a year from now? If you're asking yourself, well, I'll do it next year. That's happening in your personal life and your professional life. You don't have a plan. You don't have a map. And you keep telling yourself someday. That's called the someday syndrome. Someday I'll join that. Someday I'll take that course. Someday I'll do more. Someday I'll listen to the podcast. Someday I'll actually write the protocol. Someday I'll do the strength conditioning program. You keep having the someday syndrome, and you want to get over that. You got to be around people who are inspirational, aspirational. So if that's for you, the academy is next. For the rest of you, I'm excited to see you inside my barbell course. It's happening next week. I am 10 days out. For those of you joining virtual or in person, excited to see you there. And believe me, I'll bring this energy and fire so that way you can be overly confident and unprepared in your career and everything that comes at you, and being ready to have that training room mindset. Other than that, I hope you guys are doing fantastic, living the dream, and no longer thinking or living with the someday syndrome. All right, I'll take care. I'll see you guys on the next episode. Take care.